A very good day to everyone. I'm Vernon Lee from the Ministry of Health Singapore, and today I will be sharing with everyone about Singapore's experience with COVID-19 and how Singapore has rolled out different measures to try to contain the spread of COVID-19 locally.
Let me first take you through the global situation. As you can see, the information here is correct as of 11th of March, and the situation is unfolding rapidly. You can obtain the latest global situation from various sources online, including from the World Health Organization. Let me first take you through the situation in China. China has reported more than 80,000 cases thus far, with more than 3,000 deaths. But most of these cases occurred in the early phases of the outbreak, when China reported many cases in January and February. Since then, China has enacted large-scale community containment measures, which have been largely effective at reducing the incidence rate of new cases to a very low number after mid-February. However, the rest of the world is catching up very quickly in terms of number of countries that have been affected and also number of cases and deaths. You can see that many countries in Europe, the United States, and elsewhere have now reported cases into the thousands. And we are very concerned about COVID-19, not just because of the speed of spread, but also because of the current case fatality rate, which at more than 3%. It's much higher than seasonal influenza. So how did this outbreak start, and where are we at the moment? It was reported that the onset of the first case in Wuhan associated with a seafood market started in early December of 2019. By the end of December 2019, a cluster of pneumonia cases of an unknown etiology was reported by the Chinese authorities in Wuhan city. By the 7th of January, this was later found to be due to a novel coronavirus named SARS coronavirus 2, which causes coronavirus disease 19. And by 12th January, and this is a very short period after the virus was discovered, the full sequence of SARS coronavirus 2 was released publicly by China and shared with the WHO. By the 23rd of January, the situation in Wuhan city, in terms of the outbreak numbers, was very high, and China imposed a lockdown of the city. The same day, Singapore reported its first confirmed case, imported from China from a traveller from Wuhan city. By the 30th of January, the World Health Organization declared the outbreak as a public health emergency of international concern. And by the 3rd of February, Singapore had its first confirmed local case. And on the 5th of February, the first unlinked case, which means that we could not trace the origin to either a traveller from Wuhan city or from China, or from another confirmed local case. And by the 7th of February, Singapore stepped up its Dorscon level to orange, reflecting the risk that this virus poses to Singapore, and to roll out a series of measures that are commensurate to the risk. And by the 11th of March, the WHO declared COVID-19 as a pandemic, necessitating actions by countries to stop and contain further spread of this disease. So what are these Dorscon alert levels that I was mentioning earlier, and the color codes? What do these mean? So the Dorscon refers to the disease outbreak response condition that Singapore has put out to reflect the risk of any disease to Singapore and measures that must be taken to reduce the impact of the disease on our healthcare system and on society and economy. It's based on 4 color codes: green, yellow, orange, and red. And as you can see in this diagram, the nature of the disease, if it's very mild or does not spread easily, that would reflect then the risk that the disease has in terms of transmission or spread that's very low. And on the other end of the scale, you can see the color red means that there is a very severe disease and is spreading widely. Of course, the risk of the disease will mean also impact to daily life and would bring across different measures that will affect the public, from maintaining good personal hygiene all the way to certain control measures, including social distancing, to try to reduce the spread of the outbreak. And we are currently in Dorscon Orange in Singapore. So let me take you through some of the response measures that are available, and some of the current measures that are implemented in Singapore at this point. So the first group of measures are enhancing surveillance and containing the spread of disease. The second set, limiting the importation of cases and early detection of any cases. Third, community-based measures to reduce the spread of disease. And fourth, communications and public education to encourage the public to adopt good practices. So some of the measures that have been introduced in Singapore include an expanded suspect case definition for our healthcare workers to be alert to cases that may appear when they seek treatment and to refer such cases to hospital for isolation and testing. Enhanced surveillance. We have put in place an enhanced surveillance to detect cases of COVID-19 as early as possible, and this includes testing all pneumonia cases for COVID-19 and also cases that we collect as part of our sentinel influenza-like illness surveillance on a routine basis that we test for influenza and other respiratory diseases, and we've added coronavirus to this list as well. For each of the cases that we detect, we perform contact tracing and active case finding to uncover additional cases that may be contacts of the original case. And for contacts who are symptomatic, we will refer them to hospital for testing to identify these additional cases. Asymptomatic close contacts are placed under quarantine for up to 14 days since the last exposure to the case, and other contacts are placed under phone surveillance. These individuals will be contacted daily, and should they display any symptoms compatible with COVID-19, will likewise be referred to hospital for isolation and testing. We've also activated our public health preparedness clinics, which are primary care clinics that are equipped to handle and to deal with acute respiratory diseases, and Singaporeans and Singapore residents are advised to visit these PHPCs if they have any respiratory illnesses so that they can be assessed and also given the appropriate length of medical leave to rest at home and to prevent onward spread of disease. And finally, various measures for healthcare institutions, including the appropriate use of personal protective equipment and good infection control practices, are in place to reduce any spread of disease in the healthcare setting. Next, limiting imported cases and early detection. We have in place currently travel advisories for Singapore residents against non-essential travel. There are also travel restrictions in place for travellers from affected areas to reduce the importation of disease into Singapore. Temperature screening and health advisory notices are also set up at all ports of entry to identify cases early at our borders for testing and referral. Symptomatic travellers entering Singapore that meet the suspect case definition will be sent to hospital, while other symptomatic travellers will have a nasopharyngeal swab done and tested for COVID-19. This will allow us to detect cases as early as possible upon arrival. In addition to the surveillance and testing and limit the importation of cases, we have also rolled out various community-based measures to reduce the spread of disease in the community. This includes a stay-at-home notice for travellers from affected areas, 5 days of medical leave for all individuals who see a doctor for respiratory diseases or for acute respiratory illnesses, and this is to allow them adequate rest and to recover from the disease and also to prevent spread during the time when they are most infectious. We also have advisory for large-scale events to reduce mass gatherings as far as possible, and where events have to be conducted, for different precautionary measures to be taken to reduce the opportunities for spread. Likewise, we have also advised workplaces and schools to take different precautions to reduce the opportunities for congregations and for transmitting disease. In elder care facilities, because the elderly are more susceptible to complications from COVID-19, we also have measures in place to reduce transmission and spread. Finally, communications and public education is extremely important to ensure that the public follow the recommendations that we have put out and that they adopt good personal hygiene and social responsibility practices. We have put out different public education programs on TV, print, and also social media to encourage good hygiene and also social responsibility. For example, to stay at home if they are ill and to see a doctor as early as possible. We also have many different public communications platforms where we rely on press releases, WhatsApp updates, and other means to communicate as openly and as timely as possible to provide information to the public and to empower them to do something to prevent the spread of COVID-19. In addition to public communications, we have also put out various forms of communications on different platforms to healthcare professionals so that they too can stay up to date with the latest developments on COVID-19 and can take the appropriate measures to combat the disease, both to provide appropriate treatment and to reduce the spread in the healthcare setting, and also to provide education to their patients who visit them. So some of the things I've discussed earlier, for example, a good case definition that we have in place to detect suspect cases based on epidemiological factors such as travel history or close contact with confirmed cases, coupled with clinical signs and symptoms such as pneumonia. And the case definition will evolve over time as risk factors change and with an improved understanding of COVID-19. As I've mentioned earlier, an enhanced surveillance system is in place to identify undetected cases within the community who may not fulfill the case definition. And some of these that we have put in place include surveillance for all patients with pneumonia, testing of patients in the ICU and who have died from possible infectious diseases, and finally, influenza-like illness surveillance to detect any COVID-19 cases in our community. As I've mentioned earlier, contact tracing of all confirmed cases is performed for active case finding and also early isolation of high-risk individuals, both cases in hospital and also contacts to be placed under quarantine, both at home or in government quarantine facilities. This is to ensure that should anyone in quarantine subsequently develop symptoms, they would not have exposed anyone in the community. For some of the public health messaging that I mentioned earlier as well, these are some of the posters and ads that the government has put out for individuals to play their part in reducing the spread of COVID-19. This includes good hygiene, including washing of hands, avoiding touching their face with their hands to prevent contact-based transmission, to be socially responsible, to wear a mask if they're ill and to see a doctor immediately, and to avoid crowded places and to stay at home thereafter. And here are some other messages on when to wear a mask, especially if they're ill, good hygiene practices, and also what are the measures one should take when traveling to reduce the spread of disease. So in this set of slides and this presentation, I've introduced some of the measures that Singapore has taken to contain the spread of COVID-19 locally and to reduce transmission of COVID-19 in the population. Challenges for COVID-19 remains because the world is seeing a sharp increase in COVID-19 cases, which will put pressure on the containment efforts in Singapore. But we hope that with a whole of government approach and a whole of society collaboration to combat the spread of COVID-19, that we can reduce the overall impact of this disease on the society, on the healthcare system, and on the economy of Singapore. Thank you.